States. I'd like to thank our partner organizations, Cocotec, FHI 360, and Access Health for co-hosting today's webinar, and the Prince Mahidana Awards Conference Secretariat for all their help and support and for providing us the opportunity to convene this webinar today. As of today, there are nearly 100 million cases of COVID-19 recorded worldwide and over 2 million reported deaths. The US has surpassed 24 million cases and we've lost more than 400,000 people. And as we begin today's session, let us remember to honor those we've lost to COVID-19 and to extend our gratitude to healthcare workers and frontline workers who've endured a year that is more tumultuous than I think any of us could ever have imagined. The World Health Organization uses the term COVID infodemic to describe the overabundance of information, both online and offline, that includes deliberate attempts to disseminate wrong information to undermine the public health. And at no time in history have we faced a simultaneous viral pandemic accompanied by a pandemic of misinformation transmitted through technology and social media. WHO member states have recognized that managing the infodemic is absolutely critical controlling the COVID-19 pandemic and have called on governments, civil society, the technology industry, and multilateral organizations to collaborate to combat this online and in person. We've seen reviews of research that are emerging now, some by colleagues in Bangladesh, that have pointed to some categories of misinformation and disinformation. And they include rumors, stigma, and conspiracies circulating on online platforms. Preliminary classification that's focused on false claims related to illness, its symptoms and causes of COVID, transmission dynamics, and mortality. Misinformation related to control measures, treatments, and cures. But they're also documenting violence and stigma that is emerging. Colleagues at Oxford University have compiled hundreds of reports in over 60 countries of illegal sales of medical products, including test kits, hand sanitizers, vials, personal protective equipment, and medicines, and false claims of efficacy of unapproved medicines like hydroxychloroquine and vaccines have also presented major threats to the public health. Many of these also proliferate through online channels. Social network scientists talk about how there's a clear link between the exposure we have to information through our personal networks and health behaviors and outcomes, and that these can be influenced through what's referred to as 3 degrees of friendship, so a friend's friend's friend. And I think that's been part of the proliferation and multiplication and magnification of misinformation. The nature of the relationships also matters in terms of trust and expertise as important characteristics. And a person's position in the network or their position of power and influence also has a strong role to play. We've witnessed these principles in different forms around the world. And we've been able to see analysis of Twitter feeds citing key spreaders of misinformation as influencers, individuals, some national leaders that have a very wide reach. But this also doesn't occur in a vacuum, and like COVID-19, social media misinformation doesn't respect our national borders. False narratives reflect the social, cultural, and political identities and tensions that are amplified and clustered through algorithms, often for profit. We also see that laws and policies that aim to regulate information online are fiercely debated, where proponents weigh free speech and access to markets with data privacy and protection of harm to the public and individuals. And we've seen also numerous initiatives underway to combat COVID misinformation. But today we're really aiming to discuss the political, social, cultural backdrop to misinformation in Asia, and to hear about efforts by leading civil society organizations and actors that they're undertaking with governments and with big tech to combat this problem. We'll hear about patterns of misinformation in Nepal, Myanmar, and Thailand. We'll learn about some specific platforms that promote and or help combat information misinformation and discuss some emerging frameworks to promote accountability. Finally, we'll have some discussions about how civil society links to these broader efforts. Our speakers today are remarkable and courageous leaders. Each panelist will speak for approximately 10 minutes and we'll have Q&A and discussion afterwards. If you have questions, please submit them to the Q&A feature and we will queue them up following the panelists' presentations. I'll introduce all of the panelists before they speak and then they will take their turns. We will start with Dr. Nirmal Rijal. Nirmal, would you like to give a wave? Nirmal has over 20 years of experience working in international development and a focus on communications for development. As the Asia representative, country director, and project director of Equal Access International for many years, he designed and provided strategic and technical leadership to projects that combine communication, messaging, and direct outreach in Afghanistan, Bangladesh, Cambodia, Laos, Myanmar, Nepal, Nigeria, and Pakistan. And Nirmal's expertise includes democracy, governance, civic engagement, digitalization of the public sphere, and is currently involved in advising a number of development and pro bono efforts. Nirmal will be followed by Eamon Thant. Would you like to wave, Eamon Thant? Eamon Thant is a Pulitzer Prize winning journalist, and she's covered business, politics, and conflict in Myanmar, Thailand, and the United States. Eamon holds bachelor's degrees in feminist studies and anthropology from the University of California, Santa Cruz, and a master's in Asian studies from Cornell University, and most recently worked at Pandiar, which is a Yangon-based NGO, leading a team promoting social cohesion in Myanmar through digital and media literacy discussion and education. The next speaker will be Dr. Supanya Klangnarong, who is the co-founder of Corefact Thailand, a fact-checking platform of digital communities. She's also the co-founder of Digital Thinkers Forum, which is a Bangkok-based think tank on digital rights. She's a long demonstrated digital rights activist and leader in the region, is an honorary member of the Ethics Committee of the National Press Council of Thailand, and served between 2011 and 2017 as Commissioner of the National Broadcast and Telecommunication Commission of Thailand. She'll be followed by Michael Nguyen, who's the Managing Director and co-founder of Cocotech Myanmar. He leads a multidisciplinary organization to build technology solutions in health, law and governance, and digital financial services. And in the last year, he's published extensively on the application of international human rights law and Article 19 as a legal basis for combating harmful online speech and promoting technology accountability. He's a member of Yale's Computation and Society Initiative and a previous research fellow at Georgetown, and is an antitrust lawyer by training. And finally, our commentator for today is Dr. Virod Tangjarunsatian, who's Senior Advisor to International Health Policy Program, Ministry of Public Health Thailand, and Advisor on Global Health to Permanent Secretary of the MOPH, and a policy guru to many of us. He was trained in medicine at Mahidol University and served for many years in Thailand's rural hospitals. He co-founded IHPP in 2001, has received numerous awards and published over 250 articles in international peer-reviewed journals. So you can see we have a preeminent group of panelists, and without further ado, I'd like to turn the session over to Dr. Rijal. Nirmal, would you please begin the presentations?
Thank you, Kate. I'll start by sharing my screen. Yes. Good morning, afternoon, and evening to everyone on this panel and all attendees, wherever you are. I will start by a small disclaimer that this presentation of mine is based on my personal observations experience and media reports, and not on any structured study of misinformation patterns in Nepal, which to the best of my knowledge, there hasn't been any till date. Let me start by saying that misinformation is not anything new. It's been around for ages. It's just that the convergence of media that internet has brought about has kind of made it exponentially more evident in current times. Um, so nothing new, but very, I would say, expanded right now. Um, so basically, in terms of how and where misinformation and disinformation originate, there's two types in relation to COVID-related misinformation and disinformation. Basically, two types. One, I would categorize them as, at a very basic level, as misinformation, which is no deliberate intent to do harm. And these are usually extra enthusiastic yet digitally irresponsible individuals. And we see them in Nepal as YouTube, they call themselves YouTube activists, or all the online news portals that are eager to be the first to share. So even from only reading headlines, so it's all about sensationalism and being the first to break news or share the news. So that's misinformation. The second is more disinformation, which is more deliberate intent to misinform. It is more propaganda. And primarily in the case of COVID, we've seen the government engage a lot in that to cover up its own weakness to the response to COVID and to divert public information to something else. And I can give an example later on. And this is the second is very political in nature. Now, coming back to misinformation, a 2018 study by the MIT's Media Lab, it, they examined 126,000 stories shared by 3 million Twitter users through a period from 2006 until 2017. And these were reviewed by 6 independent fact-checking organizations. And they concluded that 70% false news is 70% more likely to be shared and reach more people on Twitter than true stories. So, and that is true for any other social. That same study concludes that that is true for any other social media platform as well. And the other interesting fact was that people, rather than automated bots, were more responsible for the spread of false info. So that kind of debunked that whole notion that automated bots were more likely to spread information, whereas misinformation, whereas it is people actually doing that. And this is true for all categories of information, but more pronounced for political news. And I think we all will agree that COVID-19 has been very political for more than one reason. Um, and on the disinformation side, it's been very expedient use of data. So it is rather a coordinated effort to hide information and the incompetent handling of the government's response of COVID-19. In the case of Nepal, insufficient tests. I will have some data in my next slide. Initially, there was only one PCR test facility across the country. So, because of that, there was this tendency to play down the actual numbers. And of course, there was inconsistent messages about how to get tested and what if positive, what is the next step. So, and all that was fueled by Facebook, YouTube, and Twitter users, and spread very rapidly all the false information or the wrong information about what to do if tested, and likewise. Um, and right now, as we speak, while most nations are tackling their nth wave of COVID-19 infection, our numbers are reducing, and without not much done to reduce, in terms of efforts made, except for the lockdown that started on 24th March and concluded around 22nd of July. So Besides that, there was yes, of course, there was testing and others, but not some any significant effort to kind of control COVID. And I think I will assert that unreliable numbers trigger multiple narratives, which lead to this whole barrage of misinformation and disinformation. A quick look at official data. We had our highest numbers during October. So a 7-day average up to 3,839 new reported infections per day. So that was almost 4,000 infections per day. And since 8 December, the number of reported cases have been on the decline. On 8 December, it was 1,382. And yesterday, 19 January, we had 348 new reported infections. And a 7-day average shows a similar figure. In terms of death, we have until now close to 2,000 deaths, COVID-related deaths. Highest on November 30 was 29 deaths, and January 19th, yesterday, we had 4 deaths. And our recovery rate has been 97.9%. Average PCR tests per day in January was just 5,000 tests per day, whereas compared to September, October, we had about 16,000, and even that was considered inadequate. So 16,000 now to 5,000. So, you know, and the number of tests reduced just when Nepal had festivals, big festivals in October. So all of this points to the fact that there is ample space to believe that the numbers are not right. And this is the general belief among the population. Now, in terms of what are the factors that trigger this misinformation, I would list this proportionate access to information as number one, because that creates an information vacuum, and that leads to ignorance, fear, and stigma and discrimination. So the lack of consistent and credible public information, both technical and social. The Ministry of Health and Population had a bulletin every day, which has stopped lately, which has become not as frequent. But that was more a statistic update. It did not talk about anything about addressing misinformation and other things. Yeah, and disproportionate information access, it poured where it rained in most areas, more urban areas. All the media, they were out there and trying to provide information, but it was almost a drought where it did not. So there was a complete dearth of information in some areas. And novelty drives falsity. So COVID has been novel, as the name implies, and and because of that, because social media algorithms favor engagement over truth, all the fear triggered misinformation about how the virus spread or did not spread. Now coming to the politics and its distortions on the internet, they were the government's response, because the government was too preoccupied with its own political standing and its lack of capacity and denial. So they had a lot of information through the internet, propagated through the internet, and some of them I have listed here. So Nepalese have stronger immunity and can sneeze the virus away. This was actually the Prime Minister saying that sometime last year. The virus from India is stronger. Rest assured, none will go hungry or die due to COVID-19. Journalists seem to know everything. That was again the Prime Minister who said that. And as for the Health Minister, there was a complete lack of public face time, avoidance of journalist information or vaccine inadequate on information on vaccine currently is very inadequate. In terms of culture, again, BCG vaccination, most Nepalese have that vaccination at birth. So there is that connection that people make, whereas that is not scientifically proven. There is this false sense of valor and chivalry. The Nepalese are Gorkhas. We usually, we don't get infected very easily, so COVID will stay at bay. The tourism minister in early January, because Nepal had a visit Nepal here, so he said there's no COVID-19, you're welcome. And the health minister, he made a statement like people have been irresponsible, so they need to fend for themselves. So this traveled very quickly over the internet. And of course, in terms of category, I think fatigue, complacency. So now people are saying, this is enough, we can't care less. So the protective behavior is on the decline, and that is propagated on the internet as well. So that is In terms of monitoring and capacity enhancement, there are a few non-civil society efforts like the Coronavirus Civic Act campaign, fact-checking and correction campaign, and others that do a lot of training and data journalism and capacity building training. So a list of them are there. So I will end with this slide, and we saw, I think there's a lot of debates on free speech versus regulation, and where is the balance? Of course, the proponents of free speech, and which I would advocate for the same, is, there should be self-regulation rather than, state-imposed regulation. But I think the January 6th events in DC have turned the debate, almost upended it, if I might use that word. And in terms of, legal instruments, design of legal instruments in Nepal, the propensity has been for control, especially since this government came to power. So there is this huge need for civil society vigilance because, although we are talking COVID, I think the longer term impact will be on democracy and free speech. So civil society needs to be absolutely vigilant. Thank you so much.
Thank you so much, Nirmal. I think there's some really critical points that you've raised, particularly the propensity for engagement over truth, which I think we've seen the world over, and the role that leaders play in propagating misinformation over fact, the need for very clear and consistent information. And the vulnerabilities based on culture and identity. So we're going to move to Eamon Thant, and while Eamon Thant is setting up her slides and screens, I'd like to remind the audience to share your questions through the Q&A feature. We will have time for Q&A and discussion following the presentations.
All right. Let me minimize that. Hi, everyone. So I'm going to talk a little bit about the more specific situation in Myanmar, and I think I'll touch upon very similar points that were just talked about, but I want to provide a few really specific examples and yeah, expand on some of those points that were just discussed earlier as well. I'm dealing with some technical difficulties. Please hang with me for a second.
Would you like us to shift to the support, Eamon Thant, for your slides?
Yeah, if someone else could share it, that would be great.
Okay, Ivan, could we ask you to bring those slides up, please?
Great. Can we go to the next slide? There should be a slide before that, I think.
This is the second slide.
Eamon Thant, are you still with us? It appears as though your screen is frozen. Maybe, could I suggest that we move to Kunsupanya and we'll come back to Eamon Than.
So should I?
Yes, please go ahead.
Okay. Okay, thank you, Kate, and good evening from Bangkok to everyone. Thank you for having me here. So we have limited time. I will jump to what happened in Thailand. We'll go to case study first, okay? Recently, Corefact, which I will tell you later what it is, we just released our report, fact sheet on the circulation repeating of the misleading information about COVID. And you could see maybe similar to many countries, especially in Asia. Of course, it's about what to do, lockdown or not. It's about drinking something and would help you, or it's about any kind of myth and some belief that would help. This kind of misinformation already circulated early last year, and now Thailand just experienced the new wave of the outbreak, and the same false information like this coming back again, being forwarded in the chat group called Line application. So the patterns, the topic today is about the pattern, tools, and path forward. I think the pattern would be similar to other country. Most of the misinformation on news, mostly causing panic, of course, but it always come in either caring style, like because you want to send it because you care somebody you love and you want them to do something, or it come in a form of hate speech or stigma, especially when there's misinformation about someone infected, and because of different race or different nation or different religions, you would experience that kind of pattern that come. And always, of course, with our references, no verified sources or link that always come with the text, and mostly circulated via closed chat application. So in Thailand, popular one is the Line application. In terms of health literacy, I observed that it's less problematic on the open platform like Twitter, because people who are on Twitter, they don't believe in something like drink lemon and would help you from cancer or coronavirus. But of course, on Twitter, people debating about something, a public policy on COVID, and it causing some kind of disinformation as well. But in terms of health literacy, people on Twitter seem to be more aware if compared to Line application. And most of the myths are related to herbal medicine. I think particularly in Asia, people believe in alternative medicine, which I think is fair enough because, of course, in some of medicine, they have a quality that they really can increase your immunity. But of course, they should not be extreme to believe that in everything that it will like heal or cure cancer or COVID. And it mostly widely shared among group of relatives and friends, and of course many senior citizens. And it now and then is always circular and circulated. And when it's about public policy, of course, it's confusion, argument, and sometimes it's very difficult to verify which one right or wrong when based on different opinion. Cause and effect, of course, in the early state of the outbreak, I think similar to many countries, there's a phenomenon of information disorder because it's new virus and no one know about it, and you don't know what to do, what to act, and the government also don't know what to do in the early state. So rumors spreading fast, like early last year. So we call it information disorder until the government, they really can settle and they set up like the information center, and they made a press conference every day, and news and information become directly target to the audience so that it helps. It's getting better. And another cause is about the Thai culture. We call culture เกรงใจ because many times you receive misinformation on the group chat and you know that it's false, but people who send it may be senior or maybe they are your boss and you don't want to hurt their feeling or their face, so you don't tell them that it's wrong. So that's why it keep coming back and keep coming back because the culture of เกรงใจ. I think this is one of the main reasons. That's why there is a circulation of misinformation. And of course, lack of digital literacy and empathy, and many one lost in what called echo chamber. You always believe in your group think or in the platform that the algorithm that want you to see. I think similar to other countries as well. And in Thailand, we have a deep conflict on political issue for a long period. Political orientation lead to belief in conspiracy theory, and the effect is hate speech and conflict. Most of hate speech and conflict, most of them come from the mis and disinformation. And lack of action by tech platform. So like no warning on the circular misinformation. So that's why it's keep coming back. So we need more active solution rather than the passive reaction. And the competitive journalism in the age of digital era, they have to compete with online media. So now people complain that they have less trusted media, and that one of the effect of the cause and causing the misinformation. And we observe the power of social media. Of course, we have more freedom of expression and information. But at the same time, darknet or dark side of the online will also came as package, and that is made it difficult to handle it. And tools, what tools that we handle with the infodemic or misinformation? Of course, direct and speedy communication from the health authority based on accuracy, empathy, and fairness, that would help a lot. And the role of mass media, traditional one like radio and TV still play important role. They should do more in fact checking and raising public awareness, targeting especially the senior generation. And we have civic tech like Corefact. We introduce like chatbot database and having community help crowdsourcing for fact. And we have some company doing data analysis and could be used by the government or stakeholder for preemptive measures. And another important tool is tech platform and their public policy in combating mis and disinformation. And we observe what's happening in the United States. It changed overnight when Twitter react something, and the statistic of the false information reduced immediately. That the fundamental role of the platform, but of course it's controversial when you allow too much power to take platform. So that's a challenge that we are facing. So what Thailand challenges? Of course, to differentiate fact and opinion. People always confused. Sometimes people upset someone's opinion and think that it's fact. You fight so hard because you think that it's fact, but actually it's just their opinion. Especially now we have a debate on vaccine, and there are fact and opinion mix, and sometimes people confuse and they cannot differentiate. And I think if most of people can distinguish between two things, it will bring less conflict. And another difficult thing is culture of correction within close group. How you dare to suggest your parents or your boss or your friend that what you send is incorrect and you should delete it or you should change it without causing hostility or something unhappiness between people. And we still need something called open data and open government for media and public to access correct and timely information. And another challenge is myth and by trust. Sometimes people being informed that it is incorrect, but they still choose to believe it. And this is the most difficult thing to change the mindset because it deeply about trust or blind trust or myth. And political polarization, always, sometimes between opposition and the government, and bias between both sides and their supporters. so difficult to find compromise many times, and sometimes also a mess when it comes to communication and misinformation and disinformation or information operation. People say that about IO in Thailand, what can believe, what cannot believe, something like that. And how to maintain quality journalism in digital era. This is the most challenge for TV, radio, newspaper, professional media, because they have to compete with influencer, online, YouTuber, TikTok, IG, or whatsoever. Challenge between how to maintain regulation properly, but not to invade or to have state censorship, and balance role of the tech platform like Twitter, Facebook, and Line. That I think the debate about this everywhere. And what should be path forward? We should try to change individual who act as a spreader of infodemic into being a corrector. That is what Corefact trying to do in Thailand, because we believe that everyone should be a fact checker this day. We should not rely on or waiting for the media as before. But somehow media still play an important role. We should promote journalism without fear of favor as a vaccine for public, because we need so much professional or newsworthy or quality journalism this day, especially on the issue of vaccine. I think that's the most controversial so far. And we should empower digital citizen and digital literacy scheme for our generation, either in school, out of school, in community, or somewhere else, because we really need it. Not only misinformation, but now we are facing with darknet, phishing, scam, and people go to police station to summon the case every day, and the police cannot handle it. And we should promote civic tech for online user, consumer, because mobile phone now people need it, but in order to use it properly, we have to promote what called civic tech. And we have to support independent fact-checking agencies. There's many in Thailand right now. And we should engage with digital platform to regulate harmful content based on the internet governance. And we have to enact open, the government have to enact open data, digital government, and support constructive communication between stakeholders. And now I have a little time left. I would like to talk briefly about Corefact. Our initiative happened last year with the support of many organizations in Thailand, such as Thai Health Promotion Fund and other stakeholders like Friedrich Naumann Foundation or Center for Humanitarian Dialogue, Cheng Fusion, and Open Dream. We follow from Taiwanese model. Corefact come from collaborative fact-checking. It inspired from Audrey Tang, digital minister from Taiwan. She came to Thailand in 2019 in our international conference on fake news, and that brought us to the idea of Corefact Thailand. And last year our website corefact.org as a database allow everyone can log in and become a fact checker. And now we have almost 3,000 database of the news that being circulated every day. We have part-time staff and volunteer putting information on it. So we're checking today what is viral on the internet and consider misinformation, and we put it on the database, a question and answer. And once people want to check it with the keyword, it will come on your mobile phone via chatbot or website. We have Line at Corefact, that the chatbot AI, mini AI that you can interact with them and to fact check. We also have a public campaign on Facebook, Twitter as well, and some of the media fact sheets like this. We also have Corefact Live Talk that talk about current issues and what happening in the other country. And we promote newsworthy and journalism, because we also believe that facts are lifesavers. Like UNESCO said, not only nurse and doctor, but this day fact are lifesaver. And not only we providing platform, innovative platform, only platform will not work without community. So we build up community, Corefact community right now, and we have partner in many in region like Deep South Corefact or East South Corefact, and it getting more participated. Yes, even finally, in order to handle, of course, information or misinformation or infodemic, you need many stakeholders, state, platform, media. But in this day, which information embarrassing you once you wake up and before you go to bed. So we really have to empower everyone to be a fact checker. And once you are a fact checker, you'll be a change maker. Thank you very much.
Thank you very much, Kun Supanya, for a really in-depth presentation. And I think certainly many of the points that you raised, we see in many contexts. It's interesting to see specifically how you've pointed to different dimensions of information sharing through different kinds of platforms. And you've highlighted specific vulnerabilities of groups such as the elderly, the conflation of COVID misinformation in the context of political tensions, and ending with a very inspiring model for civic tech engagement. And I love the statement, everyone is a fact checker. I think we'd like to now go back to Eamon Thand and ask Ivan in tech support to pull up the slides. And Eamon Thand, if you feel free to turn off the video if it helps to run through the sound. Thank you.
Yes, thank you. Yeah, can we go to the next slide? Yeah, so in Myanmar, with regards to COVID-19, there's a few categories of misinformation and disinformation, and I want to kind of categorize them into smaller groups. The first I kind of just called information chaos, which, as you can see on the left side photo, there was a lot of fake news, of just fabricated news. This photo is from a fact-checking Facebook page that was showing that if you've read this document, it's a fake, you shouldn't trust it. But the fact that these sorts of things were really widespread is a testament to the fact that there isn't enough information that's being transmitted to the public in Myanmar, and it's not being transmitted in a very accessible way or a very consistent way. And one fun quirk, I suppose we can call it, about Myanmar is the government has a habit of printing out documents and then photographing them and then posting them to various Facebook pages, and not necessarily to all government pages or all the ministries that would necessarily be related to healthcare information. And so the information space in Myanmar is very fractured. And when you have people who already have limited access to internet, as I am a testament of, on top of internet shutdowns that are happening in the country as well, and the people following various ministries, following various government officials, it becomes really easy for faked news to become viral and to become a source of disinformation for people. And then, to add to the chaos of that, if you look at the right side picture, I included a screenshot of people discussing an update to the stay-at-home orders for Yangon, which is Myanmar's largest city, where for about 36 hours, no one was absolutely sure what the latest update was. So this was quite recent in December, where the government produced a document, an update to the order that said that either all but 3 townships in Yangon were no longer under lockdown, or those 3 townships, or the opposite. And in the Burmese translation, the official document, it wasn't clear. And we had journalists who were calling various government ministries. And if you talk to the general director of one ministry versus the vice minister of another ministry, you would get different answers. And then about 12 hours after the first Burmese language translation came out, there was an English language translation, which was also unclear in its language. And it took about 36 hours before everyone was actually clear. At least everyone who was following official government sources and reading reliable journalists and newspapers. And in the meantime, you had a very large number of people who probably just settled on whatever translation or interpretation they felt either seemed right in their hearts or felt that it would make their lives easier. Can we go to the next slide, please? Yes, and so speaking of the government, not only can they sometimes be mimicked, imitated to produce fake news, and not only are they sometimes trying to produce accurate news, but there's chaos that happens. The government has also been a source of disinformation in Myanmar. If you look at the screenshot of Twitter on the left, there was a press conference where a government spokesperson essentially argued that similar to what we were hearing about Nepal and Thailand, that there was something special about Myanmar people, Myanmar culture that was limiting spread, and that's why there were lower numbers. In the face of a lot of conspiracy theories, a lot of rumors of people wondering why, given Myanmar's poor health infrastructure and lack of testing, why there weren't very many cases. And on top of the fact that there was all of this nationalistic denial, if you try to go to that link to try and find that press conference, it no longer exists. And despite the fact that this was a video on Facebook, that video has also been scrubbed from all government websites as well as from Facebook, as far as I could tell. And then this sort of feeds into the more conspiratorial, the more nationalistic mindset of people who either don't want to believe that, or who are fear-driven in a way, that they seek out news that would help allow them to believe that Myanmar would somehow be spared. It also fueled a longer lasting sort of nationalism in Myanmar. If you look at the right-hand side, there's a screenshot of a lot of comments in response to the UK embassy in Myanmar advising its citizens to go home. And you can see that quite a number of people are very upset that Myanmar's healthcare infrastructure was insulted. But there wasn't very much conversation about sort of why people might want to leave, and the sort of responsibilities of governments to their people. It was more a very defensive posture that was taken in order to defend the Myanmar government, even in the face of a wave of COVID infections. Next slide, please. Right. And so with nationalism, xenophobia necessarily follows. You have cartoons like the picture on the left, which was in a national newspaper that is showing that COVID is being snuck in by the Burmese says, like an illegal enterer, basically. And the person is coded as South Asian, Muslim. And then on the right-hand side, you can see a photo. This wasn't meant to be xenophobic, but clearly it is. And so you have the stigma that's attaching this virus, the chaos that it's causing to outsiders, to people who are coming into Myanmar. And that also adds to additional stigma to people like healthcare workers, people who are not part of these already stigmatized groups who end up having the virus. And it caused and continues to cause a lot of people to be very skeptical of vulnerable populations like migrant workers, but also the poor and sort of anyone who is not following regulations due to either a lack of information or economic need. Next slide, please. And then the last general category of misinformation I want to speak about is disinformation that's coming out of a profit motive. So Facebook, because it's been criticized quite roundly internationally for its actions in Myanmar, have actually done a lot of work in trying to limit COVID misinformation here. So on the top, you can see a screenshot I took of what comes up when you search for masks if your location data is based in Myanmar. And basically, there is a sort of COVID information center, and they've also just limited online sales of a number of things. However, if you go into the like public pictures and groups and these other sorts of things, you can still see things are not labeled as masks or labeled as COVID still being sold and marketed for COVID-related prevention. I don't know why I put a Thai example there, but I think I couldn't find a Burmese example. And I was a little bit short on time. But yeah, next slide, please. Yeah, so now I want to move on to the government's capacity limits here in Myanmar. Policy-wise, Myanmar has one of the strictest lockdowns in the whole world, and the government, at least on paper, seems to be doing quite a lot. And yet we get a lot of mixed messages. So for example, this is a gathering of the Yangon government gathered, social gathering in a much larger number than is legally allowed under our lockdown guidance. But they are doing government work. And in the right-hand side, you can see a photo of family members gathering around a prison where a very large number of people were being released in order to alleviate overcrowding in prisons, in part to limit COVID spread. And all of these things are great, but when the public sees pictures like this, while they're being told you can't gather in groups of more than 5, while you're being told to stay at home, it sends a very mixed message to people, and that causes more rumors, causes more conspiracies. Next slide, please. And I think I want to conclude my last couple of slides by talking about the difficulties of working on this issue in Myanmar. The organization I was just working for, Pandia, has created a chatbot called Dr. Duda Chatbot, where you can get information about the latest COVID numbers. So this is a message that you get every single day. If you sign up for the chatbot, you can also sign up to take quizzes about myths and rumors about COVID. You can get the latest information on prevention. You can get information on flight and travel information as well. However, this is not something that we did in collaboration with the government because as has been covered by the previous 2 speakers, it's often quite difficult to work with the government because they would prefer to maintain control over collaboration and working with a sort of level of speed and urgency that emergencies like this can kind of require. And the problem with that, on top of the fact that even though all of this effort has been put into this chatbot, we have a very limited amount of reach. We also can't provide additional information, and we can't connect people to people who can provide additional information because we're not working with the government. So if COVID testing numbers swing from 20,000 today to 15,000 tomorrow to 24,000 the next day, we have no way to explain that to people. We can only provide the numbers. Next slide, please. Yeah, so I think what I want to end on is just to show you an example of how difficult collaboration can be. So this was from some earlier guidance from the Ministry of Health that was talking to civil society organizations about how they can collaborate with the government. And if you want, basically, at this point, if you wanted to produce any information about COVID to go to the public, you had to go through this 6-step approval process for a meeting that only meets, or for a committee that only meets twice a month. And so, especially in the very early days where people were trying to get information out as quickly as possible and limit any sort of potential huge spike, this became extremely problematic, and it caused a number of civil society organizations to go their own way and do their own thing, which one causes an issue where they're not necessarily getting the best information and the latest information, especially from the government standpoint, but 2, they're also doing something that's not really approved by the government, which could cause them problems in the future or just cause any number of issues. And so they're in an effort to enact control, the government essentially pushed people to move away from regulation in a way that potentially exacerbated the misinformation issue in Myanmar. But yeah, I think a lot of these countries in South and Southeast Asia, what we're seeing is this conflict between wanting to do good, but still wanting to maintain control. Yeah, that's it.
Thanks so much, Amithan. Again, some really important key messages. I think one thing that is striking is just the extent to which Facebook and Twitter are so prominent and prominently used. You also pointed to some excellent examples of multiple layers of information and opinion, the representations of stigma, of nationalism, of identity, the concern around mixed messages coming from authoritative sources, and also some very promising efforts in terms of engaging with technology. And that is a very good segue to Mike Lewin from Cocotech, who is going to talk to us about Meakin. And just as Mike is pulling up his slides, I'd like to remind the audience, if you have questions, please be sure to submit to the Q&A feature, and we will have time after presentations to address.
Thanks, Kate. So hi, Mike Lewin, Managing Director of Cocotech. I'm going to talk fast because try and fit everything within the time frame, and I encourage you to just fire away with questions or comments in the Q&A. Happy to answer whatever. So sort of a quick overview. You know, I'm a Myanmar American. I've been living in Myanmar for the last 8 years. Cocotech is a law and computer science organization. So I'm a lawyer by trade who's taking a lot of coding classes. We have over 40 software developers, graphic designers, data science, a handful of people with computer science backgrounds working on artificial intelligence and natural language processing. And we have a policy team. And on the premise that all of this stuff is actually probably largely 2 domains, right? 1, computer science, obviously, and then 2, kind of law and policy. And the problem is they're kind of like oil and water, right? So law and policy people are very articulate with natural language and can kind of ramble on forever as I'm doing now. They get headaches as soon as you talk about tech. Conversely, if you try and get for many software developers or computer scientists, you try and get them to explain their work in layperson's terms, they get a headache, right? Generally they're not so well trained up in sort of policy kind of point of view. And so we thought this is a multidisciplinary problem. We should be multidisciplinary. And we also thought it's important to be aware that these things don't happen in a vacuum. There's sort of a socio-historical background to this. There are power relations, right? And so we are overwhelmingly Myanmar, so 95% Myanmar nationals and 55% women, right? So and it shows you all different perspectives. So my Amithan talked about the UK embassy post. I actually don't kind of have a problem with Myanmar people getting upset if you look at it through a colonialist, neo-colonialist lens, right? The backdrop British. I'm not saying I'm right. I'm just saying how multiple perspectives can kind of change how you might conceive of that. And we know all of you who are on this call already know about COVID misinfo, disinfo. So I'll just hop into it. And please fire away with questions. I'll try and answer them when I've stopped kind of blathering on. This is a spreadsheet we've been collecting of posts that were taken down, right, by Facebook. And you'll notice, I know it's hard to read a lot of text, but the COVID fake news, misinfo, disinfo that went on, alleging that Aung San Suu Kyi, the leader of the country, Nobel Peace Prize laureate, has COVID. They alleged that she had COVID. They alleged that she had died of COVID. They alleged that she was being treated for COVID in a British hospital. All very subtle, alleging that she had been basically been captured by British powers, right? And then they would also hint, they showed videos of old photo stills of she and her long deceased British husband, right? Again, alleging with quite misogynistic characterizations of their relationship, right? Again, all kind of pulling at these strands of colonialism, power relations, trying to erode her sort of credibility, right? That she's basically been captured by British interests, right? There's false allegations of a person disguised as a taxi driver spreading COVID-19 in Yangon, right, the main city in Myanmar. There's this is typical ethnic, race, religion-related stuff. There are fake cures, right? All stuff that you've read about online in your own respective countries and languages, right? With a particular Myanmar bent, right? That there's fake vaccines being promoted, there's fake cures, that there's that this was intentionally spread by Chinese agents in Myanmar, and it goes on and on. Indigenous medicines, right, that can be cured. There was a fake fundraising, COVID-19 fundraising initiative, allegedly led by Aung La, who's the Myanmar Kachin MMA champion in the One Championship MMA league. Completely false. He's in like Northern Virginia hanging out, right? So this stuff disseminated far and wide, and talking about it's very important, but we like to do something about it. And so what we realized is the state of the art for addressing this stuff is basically a spreadsheet. This is for organizations with billions of dollars. And so the idea is, how do we balance the scales? So what happens is the content moderation flow works where Facebook, Twitter, TikTok in global South countries especially rely on civil society organizations to do the surfacing of potentially dangerous content. These civil society organizations are small, they're pretty bootleg, anywhere from like 3 people in a room to the larger ones, 20 or more people, and they have shoestring budgets. They don't have a lot of resources. There's a power imbalance there, right? When you report content through Facebook or TikTok's portal, it just disappears. You don't know what happens. I like quoting the line from The Departed, the Scorsese film, where I think it's Alec Baldwin's character. It's like civil society organizations are treated like mushrooms. You feed them, S word, and keep them in the dark, right? And so the question is, how do you kind of try and rebalance the scales a little bit, right? And so the idea is we have software capabilities, so we should just and tech's involved. So we should start with that. And so we have a platform that I'm showing you here called Meekin, which means fire watcher in Burmese. Our design team came up with the name, and we kind of pulled it internally. And its etymology, its origin is in Myanmar villages in the old. It's the Night's Watch. If you watch Game of Thrones, it's the Night's Watch. They used to post young men at the outskirts of the village who would hold torches and look out into the dark, right? For dangers, right? For the Night King, bandits, raiders, stuff like that. And this is all real Facebook data that's being pulled, right? This is a post on sort of coronavirus. These are from different countries, right? This is in Arabic. Here's a Ministry of Health repost. And this is all done in real time, kind of every 30 minutes. We'll have a search function up that'll specifically filter for COVID. And the idea is that not only are posts pulled, but also comments are pulled. So let's find, yeah, okay, here's one. These are real comments. We've anonymized the people making the comments because they're individuals. and we have had our artificial intelligence team build out a natural language processing model to pre-screen comments for containing potentially offensive language. And the idea is that the civil society organization can make a decision on what to do about it. If they want to report this is objectionable language, they can. They can add analysis, like talks too much, right? Or if you want to make something more detailed, you write about the Myanmar political context, et cetera, et cetera, et cetera, right? And you submit, and that writes to an independent database. And the whole notion behind, and we're building out lots more features than this, but that gives you an overview. And the whole rationale behind this is to kind of break this current state, where the social media companies have all the powers. Now I will give Facebook credit in particular. I mean, I think YouTube and Google have a lot of work to do because Google basically doesn't care, from what I can see. But Facebook has, once it, Zuckerberg got pie on his face in 2017 with the Rohingya crisis in Myanmar exploding. They have staffed heavily with policy people and then oriented product people to work on this stuff. And but the problem is still a lack of transparency, right? And our work is premised on an international human rights law framework, IRHL, of which there's a multilateral treaty called the International Covenant for Civil and Political Rights, ICCPR, and specifically Article 19 of that treaty, which deals with freedom of expression and appropriate restrictions thereof. And there's sort of been a rich literature evolving on this currently, led especially by UN Special Rapporteur. He's outgoing. He's left this post, David Kay, and who he has attempted to apply this framework to online social media platform discourse. And so like, why IHRL, right? So one is that it is the closest thing I think we have to considered global consensus. 173 countries isn't bad, right? Versus when Facebook makes up the rules, it's one company, right? And I do think that Facebook is now, at least the people who are working on the front lines on this are smart, and they're trying to do the right thing, right? But there's a need, as Article 19, the ICCPR calls for independent review and transparency. And to my mind, how do you deal with the problem where, as our previous esteemed speakers talked before, the governments are often not to be trusted, right? They're often have varying levels of competence, can often be bad actors who are trying to surveil content and so what do you do? What do you do where there might be conflict of interest issues for nation states? There might be issues with regards to only corporates handling it. So in my view, particularly in the global South, it means empowering civil society. So civil society, it's their country. They've lived there their whole lives. They speak the language. They know all the fine social and political context of the country that makes up slang, that makes up coded language, that makes up images meaning something specific, right? And so for me, empowering civil society is a good first cut at independent review. And I don't want to take, I just think IRHL is a good flexible framework because it has global consensus where there might not be none, but we need flexibility around that. And that involves drawing on computer science in order to build solutions that then are used to empower people, law and policy side people, of which I think are civil society, in order to leverage those tools and in order to even or level the playing field with large corporates, social media platforms, as well as governments. And I could go on forever about that, but but that's so sort of sum up. I think IHRL is, if you're going to be John Rawlsian about it, it's kind of setting public reason, meaning it's setting the terms for rational discourse in the global sphere, and then I think power relations are important as an important next step, and that's where I think civil society is very important. And the Meekin platform, just so you know, where we have, I think, over 70 civil society organizations signed up for it in over 30 countries, and we have partnerships with INGOs in, I mean, really a lot of countries. So if it's something you are with a civil society organization, you're interested in piloting this out, let me know. And I think that's all for me.
Great. Thank you, Mike. That was a really provocative discussion, first of all, to have identified an existing framework in Article 19 in terms of dimensions of speech and harm, but also for showing us a very innovative example of a tool that helps to codify that and use that framework and gather data in one place and be able to share it so that the technology companies can take suitable action. I think in terms of that and the chatbots and other innovations developed in Thailand, we're seeing some very creative and relevant responses from Southeast Asia. I'd like to turn now to Dr. Virot to provide us with wisdom, commentary, and some thoughts about potential path forward. And after that, we will address some of the questions that we're seeing coming through the Q&A.
Thank you, Kate. Good evening from Bangkok. Thank you, Kate, for this opportunity. Can the Secretariat upload the slide, please? Slide 2. This is our outline for presentation. Slide 3 is the overview of COVID-19 situation and risk communication system in Thailand. Next, please. After the first case, early January 2020, as of last week, we have 10,991 confirmed cases in Thailand and 67 deaths. On the upper panel, it is the timeline on epidemiological timeline, and the lower panel on the blue, the green one, is how the government respond. I'd like to highlight that on 12 March, we have established the Center for COVID-19 Situation Administration, so-called CCSA, which was led by the Prime Minister to serve as a single command center to a whole of government approach for effective control. Next slide, please. The risk communication system in Thailand is characterized by first, whole of government approach through a centralized risk communication system, which is managed by CCSA and led by the Prime Minister. Second, the official live TV daily briefing delivered by the national spokesperson to update situation and what are expectations from the population. The third characteristic is transparent, evidence-based information in a plain language, multilingual and sign language by TV channel, gain citizen trust and adherence to social measures. And finally, the authentic message are further amplified by CCSA to the citizen through all social media channels supported by local government and non-government health and non-health sector. Slide 6 is the governance of the risk communication. The green bubbles represent health constituency, which generate technical evidence and support CCSA, which convene multi-sectoral actors such as Ministry of Health, Interior, Defense, and Digital Economy in making containment and infodemic management. It is noted that the Anti-Fake News Center under the Ministry of Digital Economy monitor, verify, and combat misinformation in all media channel, as well as Supinya has presented, the civil society, the Corefact, and many others also contribute to this work. Next slide, I like to share the experience in managing infodemic and insight from the online survey. Next slide. Next, please. Throughout 2020, we found positive association between the number of COVID cases and fake news. Peak of misinformation and number of confirmed cases were at the same month. Next slide. When we analyze the total 595 statements which were verified by misinformation as misinformation in 2020, a few major patterns emerged. First, 28% are misinformation related to government control measures, which deliberately frighten people. This followed by 25% related to treatment. And finally, a small proportion, 3%, are related to xenophobia statement, which target specific population groups. Though it is small percent, 3%, they are very harmful and can lead to violence. Next slide. The International Health Policy Program, or IHP, in collaboration with Ministry of Digital Economy, Thai Health Promotion Foundation, Anti-Fake News Center, and with support from the WHO, we conduct a 10-week online survey between May and July 2020. And the survey assessed A, the level of media literacy index related to COVID-19 in the citizen, and B, to assess the risk communication system. Altogether, during that 10-week survey, we have 68,000 respondents through online. Next slide. This survey told us that misinformation is everywhere. It is distributed throughout the country across socio-economic groups. The penetration of misinformation through social media was so deep in the fabric of Thai society that can hinder the effort to fight pandemic. It is noted that 82% of Thai people have seen misinformation or disinformation in social media in the last month prior to survey date. The level of media literacy is 69%. This means that only 54% of the people are able to differentiate misinformation, and fortunately a majority of population, 87%, do not share this misinformation further. Next slide. As mentioned before, the social listening conducted by partners in the WHO and civil society organization. The social listening in December 2020 emerged xenophobia statement against migrant workers in Thailand. This is what we have learned recently. Slide 13, please. In December, there was a spike of infection emerged from Myanmar migrants in Central Stream Market in province called Samut Sakhon, who trigger local transmission. Data scientists independent network detect a surge of xenophobia statement, hate speech against Myanmar migrants in Facebook, Twitter, and YouTube. The network and IHP researchers came together to monitor and analyze the profile of the online conversation in conjunction with infection in Myanmar migrant worker and Thai community. You will see from the graph that this hate speech peaked on 20 December 2020. It contained racist language, trigger discrimination, and promote violence and promote nationalism. Immediately on 22nd December, the CCSA spokesperson in his daily briefing had counteracted by sending a clear and caring, empathy, peaceful message that significantly calmed down this hate speech. The peaceful message was further amplified and resonance in social media. This slide suggests that immediate and timely positive response to xenophobia is critical in counteracting hate speech. Next slide is what the speaker of CCSA said on 22nd December. Please treat Myanmar workers who work in Thailand as our good neighbor. We care each other in time of sickness. I pass on this good feeling to all Thai people. Next slide, what lesson learned and what do we recommend from our experience? Next slide, please. First, online survey is useful and low cost to monitor media literacy in the population. Second, effective risk communication is characterized by trustworthy source, daily briefing by CCSA, using tailored message, plain language, easily understood, multilingual, and disable inclusiveness. The whole of society approach is the key for infodemic management. And finally, to combat misinformation, fact-check capacity, legal framework, and law enforcement are so critical. My final slides are Kate. Given 1 year experience, we recommend 4 issues. First, strengthen institutional capacity on social listening to monitor the magnitude and profile of misinformation and counteract appropriately. Second, effective risk communication need a whole of government, whole of society approach. Third, timely counteract hate speech by peaceful message is key to prevent violence. And finally, we need effective mechanism to counteract misinformation. For example, collaborative work with fact check with international partner, in particular misinformation, which is transcend from across national boundary. We need, as Mike has recommended, that we have to ask the media platform to ban and terminate accounts which create hate speech. Thank you, Kate, for this convening this webinar.
Thank you, Dr. Virot. And I think the lessons learned that you have laid out point to additional solutions that governments can take. And I was particularly struck by this slide that demonstrates the whole of society ecosystem and this very organized way of being able to engage different actors and stakeholders, having database and data-driven assessments of where the population and the public stands with respect to what they see, what they believe. And really, most importantly, the idea of shifting from hate speech to peace speech, and recognizing that influencers have a very, very significant role in creating the national sentiment, the national mood, and reshaping opinions supportive of others that help to destigmatize. So it definitely shows us potential that just as negative and harmful speech can proliferate through channels, so too can positive messages of compassion, empathy, and public health. And it speaks again to, I think, Kunsupanya's point that everybody can be a fact checker and all of us can help us move from hate speech to peace speech. So thank you for providing that lovely model. We have a number of questions and unfortunately little time, but I would like to at least take a few of those questions, and perhaps starting with Nirmal and the first question that came from Gayatri. What is the conversation in Nepal about the risks faced by citizens abroad, and how much are Nepalis abroad referring to engaged in home-based groups over social media? I think this is a really interesting question, not just for Nepal, but the role of the diaspora in being able to play that supportive fact-checking role. So Nirmal, would you like to take that?
Yes, thanks Gayatri for your question. Very important one. I think the whole pandemic revolves around, the risks involved with returning migrants. And Nepal has a very large number of migrants working in Malaysia, in the Gulf countries, and a large number in India. And I think just to give you an example of the kind of conversations that happened pictures, images coming back of a young boy who dove into the Mahakali River just to get, because the border, that was the border between India and Nepal, and returning migrants were stopped on the other side of the border, and they were not allowed to come in. And there was this young man who dove into the river and swam across a very swift river just to get across. So that was a kind of an iconic image that struck the imagination of all people. And there were, in terms of the conversation, there were a lot of civil society organizations that advocated for the return of these migrants who were kind of put into very concentration camp like situations across the border. So ultimately, that kind of conversation is the incoming of those migrants and putting them within quarantine sites on the Nepal side. In terms of where they connected with the conversations back home, they were very much connected, especially through social media. And your question about whether the perceptions, the false information, did that kind of influence their perceptions as well? Very much so, because this whole notion of drinking hot water will keep you away, or a lot of ginger, or even turmeric and those kind of things. So there was this whole conversation around, yes, we are immune because and BCG, of course, we had our BCG vaccines as a young child, so we are immune. So yes, there is very much, there was that conversation, and social media if we look at the good side, was that even migrants far away from home were very connected with the conversation, for good or bad. Yes, to answer your question. Thank you. Thank you, Kate.
Thank you very much, Nimal. I believe that a number of the questions have been directed directly to individual speakers, but we've just seen a question from Lily Baldwin, which I'd like to pose to the group. And that is, given what you know as experts, what recommendations would you make in terms of prioritizing this issue to donors and other decision makers with resources? I think I'll leave that open, but please, panelists, feel free to chime in if you have any particular thoughts that you could share with Lily and the rest of the audience. Any response?
Shall I? I'll go again. I think we heard most of the panelists talk about media literacy, and I think that is big. That is big because much of the sharing happens. It's that that eagerness to share without reading what is inside. The tendency to not verify sources, not to see authenticity, or so all of that is linked to media literacy. So I think that is a big area that donors should focus on. Of course, information integrity, I think that's the other area that donors need to focus on. Those are two things I can think of right now. I'll let the other panelists chip in.
Yeah,
Thank you, Nimal.
I
Go ahead,
I
Mike.
agree with Nimal. I mean, I think the balance is, I think training up on funding trainings on media literacy is absolutely correct, right? And kind of like IFCN Pointner certification kind of stuff, right? So funding for newsroom or a civil society organization to prepare to get IFCN certification. That's like an official, well-recognized global fact checker certification. I think that's good. I think where donor funding needs to be careful, where it's like trying to impose sort of frameworks that are not mindful of local expertise, right? So I think there needs to be carefully thought out on what's being funded, and I think that needs to be carefully thought out to be done in not a top-down way. And then I think so to be really concrete about that, a lot of the times civil society organizations could write more detailed analysis from a historical, cultural, linguistic set of perspectives on posts or comments that they're flagging, right? You like sometimes the analysis might be cursory, right? Like just like a few sentences. I think the development aid urge is to try and fit that issue into a log frame, which makes me nervous. I think it's better to civil society actors already know all the detailed analysis. It's just bringing that out of them into their writing. I think there's that kind of support should be funded.
Great, thank you, Mike. And I see that we are at the end of the session time. And I wanted to just sum up a few key points. Certainly this panel has raised critical dynamics behind misinformation and really highlighted that while it's important to look at facts and correct facts, it's equally important to understand the meanings behind why people are believing certain information and sharing that with whom and for what purpose. So this very deep social, political, cultural analysis has to be a critical part of any misinformation sort of initiatives with COVID, but also much more broadly in societal efforts. We've also seen some very nice examples of innovations in technology from Corefact and Cotech that are being developed from within countries to really tap the potential that technology apps play in helping to counter the negative impacts of information. And those that really do also enlist and engage members of communities and civil society at the same time. And certainly those should be further developed and assessed and monitored for how they're working. We should be learning as much as we can collectively. And I know Kunsupanya would be wonderful to have more information for the audience in other countries and to remind the audience of Michael Nguyen's offer to participate in the Meakin pilot example. And I think we've also heard a very important model from Thailand of this ecosystem of support where government officials are working collectively with civil society, with communities, with the media, with researchers to understand very self-critically what the misinformation ecosystem is and how to combat that with compassion, care, and truth. So I think with that said, I would really like to thank this amazing panel of speakers for being here today, but also more importantly, for the work that you and your respective teams are doing. We've learned a tremendous amount, and just with Asia being a great model for the COVID response generally, I think you're at the cutting edge in finding very positive solutions to COVID misinformation. So thank you again. It's been a pleasure to be part of this effort. Thank you to the audience for taking the time, and we look forward to staying in touch and continuing to build on this momentum. Thank you all.
Thank you. Bye.
Bye. Thank you.
Bye.
Bye, thanks.
Thank you. Thank you.
Bye.